name is Nick Rohs. I'm an assistant professor at Mount Sinai Hospital in New York City. I'm a thoracic oncology specialist, which is why I'm here today to talk about the IMpower010 trial. So this trial is a really exciting trial. I think it was one of the most impactful trials that came out of ASCO this year, and it is focusing on adjuvant immunotherapy. So the IMpower010 trial was a large trial. It had over 1,200 patients who were entered and over 1,000 who were randomized in a 1-to-1 fashion. And these were patients with non-small cell lung cancer who were going through curative intent surgery. These were earlier stage patients. I believe it was 1B through 3A. And these were patients who went through surgery and then received an appropriate platinum doublet after their surgery. This was a cisplatin-based doublet, so cisplatin plus pemetrexed, taxotere, gemcitabine or navalbine, I believe, and then they were randomized 1-to-1 to either atezolizumab 1,200 milligrams IV every 3 weeks versus best supportive care. So I think that's probably where my first point of discussion is that they were randomized to best supportive care, which I think is a little bit of a miss there. I would have liked to see this randomized to a placebo, but I understand it's difficult to get somebody to agree to 16 infusions of placebo. So these patients went through this, and what we saw at ASCO this year was a pre-planned interim analysis of their primary goal, which was disease-free survival. So they had a hierarchical statistical method where they did disease-free survival. I believe they originally did it in the PD-L1 greater than 1%, and then they go down to the intent to treat population, and then eventually they trigger over to overall survival. So I think that's also where a lot of the debate is coming here. But these were really intriguing results. In the greater than 1% PD-L1 expressors, that there was a hazard ratio of 0.66. So another point of discussion that we've been having is that a lot of these benefits were probably driven by the high PD-L1 expressors. So the ones who had the TC greater than 50%, the hazard ratio was actually 0.43. And when they looked at the less than 1%, it was 0.97. So there's definitely a lot of this benefit that's being driven from the high expressors, but we do see a benefit in all PD-L1 expressing tumors. This data is very early. This was a pre-planned interim analysis. We're still looking for this data to mature. I think everybody's really excited about hearing the overall survival data, but I think that this is definitely an impactful study, and I think that this will be speaking to the future of non-small cell lung cancer in the curative intent surgical setting. We've been seeing a lot of exciting data out of the neoadjuvant and now the adjuvant space. We've seen the NADIM trial, the Keynote 816 trial, showing really intriguing chemo IO and IO neoadjuvant data. So seeing that paired with some really good adjuvant IO data, I think that this is the advent of the at least perioperative therapy with IO for these patients. So I think it's really good to see some separation of the overall survival curves early. We got a little sneak peek at that, but definitely still immature. I think being able to see ctDNA data for minimal residual disease and how that may be affecting these results is going to be really interesting. But I'm pretty confident that immunotherapy is here to stay in the perioperative setting. So these are really exciting results. I think we're all looking forward to seeing more of them. I think really one of the biggest debates that we've been having in this space, as well as in other solid tumors that have been having some of this neoadjuvant adjuvant data, is disease-free survival really our meaningful endpoint. I think overall survival has always been our gold standard. I don't think we've really ever defined this except for maybe recently in the ADURA trial, which used EGFR TKIs. And I think that hazard ratio was so striking that more people were really willing to adopt that, but there's still a lot of debate. So I'm looking forward to seeing this data set mature, and where we go from here, I think can only be up and onwards.